My name is Claire Kewart, and I would like to share my experience. My son, Benjamin Michael Kewart, was born August 24th, 2014, and we spent 71 days in the Duke ICN. My delivery was uncomplicated. My pregnancy went great. There were no medical issues. And at 41 weeks, went into labor in Greenville at Vidant Pitt. And when I delivered, you know, they placed him on my chest, and he was just the most beautiful thing I'd ever seen. And when they took him to do his assessment, that's when they realized that something wasn't right. And he was unable to breathe on his own. He was diagnosed with PPHN, which means persistent pulmonary hypertension of a newborn. And he was in acute respiratory failure. You know, they were unable to get him stabilized there. So within several hours of delivery, he was airlifted to Duke. And when we got there, they tried to stabilize him there in the ICN for, I'd say, maybe 12 hours. And within 24 hours of his life, he was on a procedure at Duke called ECMO. What they described to me, a heart and lung bypass. So what that does is it takes all the blood out of his body and oxygenates it for him and puts it back in. And in that time, it just gives his body time to heal and get well. And he was on that procedure for 5 days. And then luckily, he was able to be weaned off of that and was able to oxygenate on his own, which was a very happy day when that happened. What it looks like is very scary. And they told me that just due to being exposed to that plastic, you know, he would swell. So he was very swollen. There were lots of machines around him. It was traumatic. You know, it's a memory that I will never forget, seeing him on ECMO and just the fear of not knowing if he would ever be able to successfully come off of that. It was a very scary time. After that, we transferred into the ICN. And then our process became an extended stay due to feeding issues and also to wean off the medications he was on when he was on ECMO. He was on a lot of sedatives, morphine, so he needed to wean off of those, which was also, you know, very tough to see for that, you know, 2.5 months. He had several airway things going on. He had vocal cord paralysis. He had laryngomalacia, which is kind of floppiness of the airway. So both of those made it very difficult for him to be able to drink. So our stay was a lot of working on the feeding issues and then helping him get off the medications that he needed for ECMO. My experience in the NICU, it was very lonely. We didn't live in the area. We weren't from Durham. We didn't have any family or friends here. So after 2 weeks, you know, around the time Benjamin was on and off ECMO, and about a week after, you know, my husband had to go back to work in Greenville. So during the weeks, you know, I was 16, 17 hours at the hospital, and the rest of the time I actually stayed at the Ronald McDonald House, which was a wonderful resource, you know, to use while we were here. It was very helpful. In the ICN, there are people all around. I mean, there are people everywhere, but I've never really felt more alone, you know, in my life than being there while he was going through this. So there are things that I did to try to normalize my time with him in the ICN, things to make it feel like, I guess, we weren't there. Bath time was probably my favorite part with him because that was the time that he was not attached to any type of monitors. You know, I could move freely with him. I wasn't tangled up in anything. And then just for that brief moment, you know, I felt like we weren't there, like we were free. We weren't, you know, we didn't need any of that, which obviously we did. You know, we did need it, but so that was a good time. Every night at bedtime, I would get in the rocking chair with him. It would be around 9, 10 o'clock at night, and I would reiterate to him that this is not his home. And I would start describing his nursery to him in detail. A 30-minute description of what his nursery looked like, and just until he fell asleep. And then also, in my mind too, it took me home. You know, even though I wasn't home, but it made me, you know, just feel good sharing that moment with him for the very last few minutes of the day when he went to sleep. We were in the NICU for 71 days. It was like a roller coaster. You know, there were good days and there were not so good days. And just one of the very challenging things too was watching him withdraw from these medications. There was one day, I remember I came in the morning, I'd get there around 7 a.m. and he was crying. His NAS scores, which is his neonatal abstinence scores, you know, that they monitor when a child is withdrawing from the stuff, had been going up overnight. I went and picked him up, and then he had a seizure in my arms. And that is another memory that will be forever, you know, just kind of burned in my brain. You know, I'll never be able to forget that and how tough that was. So watching a child go through that it was very challenging. You know, I pray every day that this will be the most challenging thing I'll ever experience. So after, you know, we made that decision to go with the G-tube, it was a tough reality to think about, but I knew one that was necessary for us and him. So got the G-tube placed, and then he still was on methadone. He finished his last dose of that pretty soon. No, right before his G-tube surgery. And we were still on clonidine was what we were on. And then it was within, you know, a week or two, I started to get a little bit more excited, more happy, because I knew, you know, we were coming to the end of this journey. And then our very last night, we got to sleep in, I can't remember what it's called, the parent room or parent something, where we get to actually spend the night in the room with the child. And that was, you know, the first night in there with him, where my husband and I cared for him all night. And then the next morning, you know, just taking him off the monitors for good was just a very good feeling. It was like a victory, you know, getting him off of those and getting us home. And then the schedule, you know, we were on about 8 feedings through the night, and then his G-tube feedings were an hour each one. So it was a very, and then pumping also, you know, I would pump every 2 hours. And then I needed to start back at work because I was in the hospital we were there for 12 weeks. No, we were there for 10. And then I had 2 weeks left of my FMLA. So I was able to spend 2 weeks at home and then get started back at work. When we got home, the hospital referred us to the CDSA, which I think they refer almost everybody there when they leave. And what that is I think it's a state group. I mean, I think it's a state-run program. And they help you get set up with all the therapies you need when you leave. So we had feeding therapy, a nutritionalist, and physical therapy. And the people that we worked with were great. They were so helpful, and it was really beneficial. They really helped me with the G-tube and trying to help get him transitioned off of that. It was 11.5 months when we weren't using the G-tube at all. So at about a year, you know, we needed it. But they wanted just in case of an emergency, and through the winter, they like to keep it in, you know, if the child gets an illness or gets sick. So it was March when we actually had it removed. So he was about 18 months when it came out. And that was probably, out of all of this, other than when he came off ECMO successfully, that was definitely the happiest day in all of this, was when that G-tube came out. What I would say to someone going through this is to try to really take it day by day. I think one of the most important things is going to be, and you're going to hear this a lot, and I heard it a lot and I didn't follow this advice, but it's very important, is just taking care of yourself. When I was in the ICN with Benjamin, you know, we were there 2.5 months. I lost about 30 pounds. You know, I would skip meals. If he was awake and fussy, I would not go eat dinner. I would stay with him, which then made the whole process a lot more stressful than what it needed to be, because I couldn't pump the milk I needed, because I wasn't getting the nutrients I needed, wasn't really getting the sleep I needed. So I think that, well, I don't think I know, you know, for me, that was a very important thing to do, you know, that I did not do as well as I should have. So it's just so important to take care of yourself so that you can be there. Because this is a long journey, you know, and you're going to need a lot of energy and health. And so taking care of yourself is very important and critical. So Benjamin was born, he was full term, you know, he was born at 41 weeks and with PPHN and several other medical issues, but that was the primary. And now he'll be 2 on August 24th, so 2 weeks, and now he's doing excellent. You know, he is meeting all of his milestones. He is talking up a storm. We just also got discharged from the Special Infant Care Clinic. We went about a month ago, and he did his psychological testing, and he's as healthy as a horse.